Good evening. I'd like to this more of a discussion rather than a monologue, and with due respect to all my seniors. I just, before we move to healthcare and what all it is, I'll cite my personal example. I was also equally confused 20 years back. So, I come from a family where if somebody is not able to do anything in life, becomes a doctor. So I was 74th doctor in my first relationship. So I had my uncles in US, in cardiology, in orthopedics, in critical care. So finally means my mom is a doctor, dad is a doctor, sister is a doctor, brother is a doctor. And I have seen this in and Nana is a doctor, Nani is a doctor. That is the kind of life I have seen. So I decided I need to do something different. And I was very clear I am not going to waste my time with patients. So there was no option post my MBBS other than to do a post-graduation. Though not a great student, still I got admission to all the master's program available. But I decided to spend time as a resident in emergency in one hospital, one of the respected branded hospital in Delhi, way back in 1992. After 6 months, I was getting a salary of 4,000 rupees and a single-seated hostel accommodation as a RM. This was in 1992. After 6 months, I requested the medical director that I have no interest in clinical field and I want to move towards managerial side. What should I do? So at that point of time, there were not many programs in India. So I tried to find out what I should do. I got a reference that there is a MHA program in AIMS and it has got 2 seats. And you need 5 years experience and blah blah, and at the end it goes to public sector employees. So I requested them, why don't you give me an opportunity, I'll learn on site. So they said, fine, we also need people like you. So my salary was reduced from 4,000 to 2,500. And I was asked to leave the hostel because that was only for residents. And then I was made coordinator for cardiac cath lab and I was given a stool next to nursing counter. This is how I started my career. This was 20 years back. Over last 20 years, I have been interviewing people as a head of the hospital position. We spend on an average 10 lakh rupees just to reimburse travel costs of people to identify the right candidate. I had a boy from this city, Pune, who did a hospital administration after BUMS. After BUMS, he joined me just some 7 years back. Right now, he is heading a healthcare vertical in South India with a package of around 1 crore annually. So that is the kind of, if somebody calls me and tells me that we are ready to offer you X or Y, it has no interest to me. So what I am trying to say that I met another example, I met a very leading psychiatrist who came for interview of his son. I was conducting an interview for hospital managers at Nagpur. So this gentleman who was around 57, 58 years came and I interviewed his son, very sharp guy. He has done a BSc in biology and then after that he has done a MHA program for an institute in Indore. So his father gave me a half an hour lecture that how idiot is his son, who could not become a doctor. And the guy was kind of having a feeling that his life is wasted because his son has not become a doctor. Day before yesterday, that gentleman was traveling next to my seat from Delhi to Mumbai. And this boy worked with me for 4 years. He must be around 30 to 33 years. He is today CEO of a leading group in Delhi. On a package of, his father was saying 70 lakh rupees at the age of 32 years. So what I am trying to tell you is that earlier who were managing hospitals? It was somebody who was head of the department, who has done enough of clinical work and who has interest in administration used to take over this. First job officially when I went to apply in Delhi, I was told that why you have come, we have no seat for medical supervisor, no seat for RMO. So I said I have not applied for RMO. You people have sent me this letter for the post of medical superintendent, you are invited to appear for the interview at blah blah. I am here. So he said, but you don't have a white hair. And all people sitting next to me were brigadier, general, everybody was around 60. And there was a board member of 7 people, including Ms. You may be not knowing Dr. Bhargav, Mrs. Bhargav, yes, head of radiology at AIMS. So she told me, you are very young, why you have come for this interview? So I told her, see, Newton's father was not Newton. At that time also apples were falling. What I am trying to say today, if I interview a candidate who is above 35, I don't waste my time. I was heading WOCAD group 15 hospitals. My Nagpur unit head was a 25-year-old girl. She is still there. Right? All our hospital heads were below 33, 34 years. Today, that is, nobody has a package of less than 20 lakh rupees. Today, if you need to get a good hospital head, I don't think anybody can get a quality hospital head below 50 lakhs. That is the scenario. If you are inviting somebody, then you need to be very clear you are not going to get that product. Secondly, it's a misnomer that medicos only can manage a hospital. Today, healthcare per se is a very smart business. It's an industry. So people, I also teach at Tata Institute and take few lectures. And it's a beautiful combination. You have BE computer science from very respected groups who come and do this program. If you see in US, the highest paid IT professionals are people who are working in knowledge-based domains, and healthcare is one of them. People who pass out with the masters or similar program, post their education, they start package today generally is in the range of 6 to 12 lakhs. This is this year average package that I am talking about. So people from biomedical engineering, people from nursing, people from allied healthcare, people from medical education, by choice are preferring these professions. You reach to your senior position level by the age of 30 plus minus. That is the level you start enjoying what you want. Number 2, just to give you a very small idea about where we are moving. I remember there was a front page news in Hindustan Times. When Escorts was coming up, it was a hospital with 60 crore investment. And it was a front page news in Hindustan Times in 1985-86. Today, if somebody says that I am investing 5,000 crore, it's not a great news or a news of great interest. Every day we meet people who are talking about 1,000 crores, 2,000 crore investment. Today, presently, Indian healthcare is 3 lakh crore, which is going to double every 3.5 to 4 years for next 20 years. Some of the best professionals who have risen very fast, if you compare across industry, healthcare is one of them. And anybody who has got inborn leadership quality, anybody who feels that they are good in management, anybody who loves to do multitasking, anybody who has passion to deal with public, this is a job you enjoy. So, I have been traveling for last 12 years. Manisha doesn't know how I have reached. Day before yesterday I was in Jammu, then I went to Jalandhar, then Delhi, then Jaipur, then Bombay, and today in Pune. This is last 2 days and 4 hours this journey. I traveled 250 days in a year. No job can give you this kind of satisfaction. It's out of passion people do it. You feel so good, so great about it, you create an infrastructure. It is like first bypass in the region, first joint replacement in the region. And I'll be very proud to say that end of the day what people want is number one, you should have energy to get up in the morning and go for work. I can tell you, you will have so much of energy, you will not even sleep. Number two, you should be socially recognized. Everybody needs few people in crisis, lawyer, doctor, and what we do in crisis, people remember ever. One can buy anything with money, but one can't save life. So if you have helped a person at that crunch moment, they will be obliged throughout life. Third, we need a quality of life. I can tell you, if I would have been among the best cardiologists in Maharashtra, I would be making 1/10 of what I am earning today. So this is the present scenario. Today, people want to have young leadership. I want to have a hospital head who is 25, 30, 35 years, so that I am mentally free for next 20 years. Please understand the investor mindset. They want responsible people who can serve them for longer period of time. And